Hi everyone, my name is Yun, and thank you for attending my heat illness class today. Today, the discussion will be involved in three types of heat illness. First, it will be heat cramp, heat exhaustion, and heat stroke. Most of the heat illness is usually caused in environmental-wise. As far as the exposure to high heat for too long, or lack of intake of water fluids, or not taking enough rest after a long work day or outside. So as our responsibilities, we need to make sure our friends, co-workers are taking enough water prior to if they do any type of field exercises, PT, make sure they take enough water, and also taking plenty of rest before doing anything next day. As we're looking at this slide here, poor made slide, but please excuse my slide. What we're going to do is, the first topic we're going to talk about is threats. Usually the threats involves into the environmental condition, like doing PT, especially humid days. Those are the high risk time that we're looking at. Usually another factor is assumption of taking medications, use of alcohol, or prehistory of heat illness, skin disorders such as heat rash or sunburns that prevents from effective sweating. And the next page here, we're going to talk about the heat cramp. Heat cramp is something that we counter, probably it's the most time that we counter something, because we don't have enough water in our body system, and which is it creates a cramp on your muscle, like arms, your abdomen, or your legs. The best way to treat this type of heat illness is to let the soldier or the personnel who's actually experiencing this to move to the shade. They're in the sun. Let them sit down and stretch out the muscle as much as possible, and also provide them with the room temperature water. That actually helps. Next subject will be heat exhaustion. Heat exhaustion is something caused by the loss of body fluid, excessive sweating, but it doesn't replenish water for your body to the adequate water. That's pretty much an easy way to say it. The body is not functioning correctly to replenish adequate water. So the symptoms of this, you're looking at moist skin, cool skin, nausea, sweating, dizziness, loss of appetite, cramping, and also maybe vomiting. The best way to treat this type of heat illness is if they're outside, move the casualty to the shade, let them sit down, provide room temperature water, loosen up the clothing, unblock the shoes, and fan the casualty. And also, and take a wet sponge, and apply it on the forehead to reduce the heat on the personnel's body. Do not splash the water, cold water, to the casualty, because that could prevent, that could cause the casualty going to shock. Next topic will be heat stroke. Heat stroke is pretty much the life-threatening heat illness. If you ever encounter somebody like this, the first thing you need to do is make sure they're alert. They know their name, they know where they are before you actually conduct any type of treatment or moving the casualty anywhere. But the best way to treat this casualty is move the casualty to shade if they're outside. Same thing. You unblaster the shoes, loosen up their clothing, provide warm water, like room temperature water, and also elevate their feet to get the circulation going. But the most important thing is, once you do that, call 911, seek for medical attention, and just keep an eye on the casualty to prevent any, going into shock or anything like that. And also, our defense to prevent from heat illness risks. The best way to do this is drink plenty of water before you do any type of physical exercise, like going outside or hiking or just having fun with friends, going to the beach. Just have plenty of water. Good rest, that's the key. And make sure you drink like sports water drink if you do any type of physical exercise. Next page here, it shows the heat fatalities from 2008 to 2013 in the United States. As you can see, from California, which is very dry, heated area, very high temperature during summertime, and also the heat illnesses happen not just summertime, but more likely during the wintertime, because we forget to intake water, because we feel it's not a necessity thing to do, like during wintertime. You don't really sweat and you don't ask for water, but all the sudden movements, any type of physical exercise, anything, that will get you dehydrated. And more likely you feel when you're dehydrated, what you're gonna feel is when you sit on the chair for a long time and you try to stand up and you walk, and you might see like a white light in front of you for a little bit, or kind of dizzy. That's the first sign you will encounter if you be dehydrated. And also that's the very first sign of the heat illness. Next page here, it deals with the rest fluid intake. This one shows a chart of like at 90 degrees or less work rest time, and it's not needed, but the water intake is as needed when you work at that type of temperature outside. Next thing, 90 to 94 degree. We're looking at 10 minutes of rest every hour, 12 to 24 ounces of water intake. 95 to 99 Fahrenheit, you're looking at 20 minutes of rest time, and we're looking at 24 to 36 ounces of water. And this all can be found at on the website heataware.com, and they'll tell you more in details. If you don't know about how much water intake you need to do per day, you can actually look on this chart here. This chart shows, depending on your weight, it shows how much water intake you should actually intake. Like for instance, I weigh about 190 to 200, depending what I eat, and we're looking at like 80 ounces of water. I mean, it doesn't mean you have to chug it like all at one time. It is impossible to do that. But throughout the day, try as much as possible to drink 80 ounces of water, which that'll get you up to 70% as your body, the water needs in your body. And also another method here is something you can find out how much water you need in your body is your body weight divided by 2, then divided by 8. And it tells you how much water intake you need. The 8 is pretty much representing 8 ounces of water. So, and shortly here, I'm going to show you how to, for the heat stroke, how to, as far as treating the casualty. If you sit here for me. Alright, the first thing to do when you encounter a heat stroke casualty, what you need to do, you approach the person before you move anything, and make sure the person's alert and saying, "Hey, what is your name?"
Bob,
Bob, are you alright?
I'm tired and hot.
Okay. What event were you doing before this?
I don't remember.
You don't remember? Alright, let's get...
Cleaning out a Connex.
Alright. Let's move you to a shade. Once you move the cast to the shade, what you do is, you unblouse the boot. I'm not going to really unblouse his boots, because it's kind of pain to do it, but you know, you unblouse the boots, and you take them off. And what you do is, you take the boots off to elevate it. You put it underneath, so the feet will be elevated. It's about like right here. And what you do is, if the shirt is tucked in, you untuck it, and same thing. And you take a wet sponge and just kind of rub it here, and give him, room temperature water, and for him to take it. And call 911 and seek for medical attention, and also just keep an eye on them. Thank you. Any questions?
You say the best way to prevent this illness is drinking water. Can I drink tea instead of drinking water?
Tea, depending on what kind of tea. But
if I want to drink green tea.
Green tea usually has high caffeine, so I wouldn't really recommend it. I would say just replace it with like a Gatorade or something. That will provide electrolytes to prevent from heat cramp. Yes.
Coffee has water in it. Is that okay?
No, coffee is not a good substitution. Yeah, the water, milk seems to work too. Milk helps you get satisfied the thirst. So I would say water, milk, or sports drink. Any questions? Alright, and that concludes my class on the heat illness, and thank you for coming.